Here is a size 3 and a size 4 scalpel handle. These two scalpel handles are included in all surgical packs. Here we clearly show you a size 3 handle with a size 10 blade, and here we show you a size 4 handle with a size 22 blade. Next, we will demonstrate how to safely load a blade onto a handle. Remember, the objectives are to A. Maintain sterility, B. Maintain blade sharpness, which means not touching it off other instruments unnecessarily, and C. Reducing injury risk. A needle holder has strong, secure jaws and is therefore the most suitable instrument for this purpose. The blade is grasped across its width, leaving the window fully available for loading. Check the slant at the end of the blade is in the same direction as the slant on the handle. The blade is lined up so that it easily slides downwards. To safely remove the blade, there are two methods. One is to remove the blade with a needle holder. Grasp the blade firmly at its lower tip by turning the handle so the blade is underneath the handle, and slide the handle back while the blade remains stationary and pointing down. This ensures control of the blade and prevents it from flying off the handle. Dispose safely in a suitable container. The second method is to remove the blade with the help of a gloved finger. This is acceptable at the end of the surgery when a glove puncture is not critical. Turn the handle of the blade uppermost and position the index finger under the end of the blade and lever it upwards. Here are three commonly used hemostatic or artery forceps. They have jaws, box joints, and a ratchet mechanism that locks the jaws when required. From left to right, we have a Cryle, a Kelly, and a Halsted mosquito forceps, which you will note is a smaller, finer instrument than the other two. Here the box joints are shown in the open position, and it's important that this area is carefully cleaned after use and before autoclaving. This demonstrates the jaw surface of each instrument. From left to right, we note that the Kelly forceps has cross serrations across half the length of the jaws, while the Cryle and mosquito forceps have cross serrations across the full length of the jaws. This shows the Kelly, Cryle, and mosquito forceps, which are very common surgical clamps, in relation to each other in order to demonstrate their scale. This is the Carmelt-Rochester Haemostatic Forceps with curved jaws, though it can also have straight jaws. This is longitudinal serrations with cross-hatching at the tip, which prevents tissue from slipping off once clamped. This is used for clamping large vessels, or for example in your triple clamp technique to ligate the ovarian pedicles in a spay procedure. This is an Alice tissue forceps. These are used only on tissue that is to be discarded from the body, as the tips are very traumatic due to their strongly interlocking teeth. From left to right, we see three Adson-style tissue or thumb or dissection forceps. The fourth is a traditional tissue forceps. The difference in design is clearly seen here. This shot shows the difference in design for identification purposes. The Adson forceps have three different types of tips. From left to right, we see the toothed Adson Brown forceps, the 1-2 Adson rat tooth forceps, and the plain serration forceps. Again, the fourth is a traditional 1-2 rat tooth forceps. In this shot, we also see the traditional tissue forceps with a 1-2 rat tooth tip when seen end on. It is important to recognize that these instruments can be traumatic if used incorrectly. Therefore, never hold them in a palm-over instrument fashion, as this just puts too much unnecessary pressure on the live tissue. This is incorrect handling. Instead, hold them as a pen whereby the index finger and the thumb are having precise control over the tip of the instrument. This video shows the Mayo scissors on the left and the smaller Metzenbaum scissors on the right. Both of these scissors are commonly included in surgical instrument packs. The blades of the Mayo scissors have dished surfaces, and these are used to cut tougher tissue. These have curved ends to improve visualization, although it is possible to have straight end Mayo scissors also. When cutting, the tips should be used rather than closer to the box part in order to have precise visualization and avoid inadvertent cutting of more distal material or tissues. The Metzenbaum scissors has replaceable tungsten carbide inserts in the blade. This is denoted by the gold handles. Tungsten is much stronger than steel, but it is also much more expensive. Consequently, these are not to be used on tough material like fascia or indeed suture material in order to preserve the sharpness of the blades. If used properly, they last for a very long time. The Latour suture scissors was designed to remove skin sutures by using the hook at the end, which is placed inside the suture loop before cutting. This is a point blunt suture scissors, of which there are straight and angled versions. As you can see, the scissors has one sharp pointed tip, and as it is turned around, you can appreciate the other blunt tip, which can be more safely laid close to live tissues in the surgical field. These are often used for cutting sutures and other non-surgical procedures. Needle holders or drivers are of various sizes depending on how fine the work is or how large the needle is being used. In this shot, we have from left to right Gillies needle holders, Mayo Hager needle holders, Olsen Hager needle holders, which is the same as the Mayo, though has an included cutting blades further down from the jaws, and the Mathieu needle holders. This is the commonly used Mayo Hager needle holder or driver. The jaws have crossed-hatched serrations to grip onto the needle. As a ring-ended instrument, it is held in a tripod fashion using the distal phalanx of the thumb and the ring finger, with the index finger placed further down the shaft. This method ensures optimum stability and control. Alternatively, the needle holder can be held with a palm grip, whereby the thumb is used to open the ratchet mechanism. Again, it's important that the index finger is kept further down the shaft. The ratchet handle locks the instrument in place and should only need to be clicked once to avoid damaging the needle. It's important that the needle is grasped at the tip of the jaws of the needle holder and roughly 2/3 of the distance away from the needle tip. Here we have instruments that are typically used for suturing. As described before, we have a Mayo Hager needle holder. Here is a rat tooth Adson tissue forceps, an Adson Brown tissue forceps, and a point blunt scissors for cutting suture material. Here is some swaged on suture material with a curved triangular cut needle. We also use eyed needles, where the suture has to be manually placed through the needle. Both of these needles are 5/8 curved. Here is a straight cutting needle used for skin and usually used by hand. As you can see, the material is also swaged on here. In this hospital, surgical packs are wrapped with blue outer paper with green paper inside. The outer blue paper is opened by non-scrubbed personnel who take care to handle the outside only. The inside green paper is opened by the scrubbed and gloved surgeon only. Note the autoclave indicator tape. This should display uniform dark brown stripes. Note the date the pack was assembled, the name of the person who assembled it, and the description of its contents. The blue outer wrap doubles as clean outer field and should overlap the edge of the trolley or table by at least 12 centimetres when opened. The green wrap is opened by the surgeon, who should also note the colour of the autoclave indicator tape. The surgeon opens the pack from the inside centre outwards, keeping gloved hands inside the green paper. In this hospital, surgical soft tissue packs have a list of instrument contents which the surgeon ticks off before and after use. A time steam temperature or TST strip from the centre of the pack shows that the steam was at the correct time temperature at that spot and indicates to the surgeon that the instruments are sterile. Here we show you TST strips before and after. As you see here, the steam temperature should either be 121 degrees centigrade for 15 minutes or 134 degrees centigrade for 3.5 minutes. This relates to one instrument. For larger instrument packs, the time at optimum temperature is accordingly increased. Here we have our sterile instrument spay pack laid out as it would be in the theatre. It's laid out according to surgeon preference, but always in an orderly manner. What we haven't seen explained previously in this video are these instruments, which are suction tips, and they will be described in the next part. Also, there will be surgical gauze pads included in the pack, and it is important to count these carefully twice before beginning surgery, note the number to staff, and document it before starting surgery. Also, before closure of the abdominal cavity, the number of gauze swabs is documented in surgery records. These are the suction tips. These are the parts that attach to the suction tubing apparatus. This instrument is a Yankar suction tip. This is a pool suction tip. This is a Fraser-Ferguson suction tip. It is a controllable suction tip. Placing the index finger over the hold varies the degree of suction. The tip of this suction instrument is much finer than the other two. The pool suction tip is used to remove large quantities of fluid from surgical sites, often in the abdominal cavity. It can be unscrewed. The outer cannula has multiple holes and a blunt tip so as to prevent blockages caused by fat or tissue. Cleaning is facilitated by separating the layers. The Yankar is often used in the oral cavity and is designed to allow effective suction without damaging surrounding tissue. The tip of the Yankar can also be removed for cleaning.